you for the privilege of your time and the opportunity to bring our press conference on the road here in Stockton, California. I want to in particular thank Mayor Tubbs for accommodating us and providing us the opportunity to be here at one of the most vibrant and dynamic economic engines here in the region, and that's Diamond, where we are about 500 co-workers, employees, represented by Teamsters and others that have dynamically worked their way through this pandemic. Despite a few infections, a spirit of collaboration, a spirit of cooperation, a spirit of engagement allowed this operation to get back on its feet. A positive working environment and a positive and, more importantly, collaborative environment with county health officials, local officials, and state officials. And I just want to acknowledge this example as exactly the kind of example we want to see replicated all up and down the state of California. When you're in these larger processing plants, invariably, when we have so much background spread, so much community spread, the likelihood of transmission of COVID-19 is relatively high. As a consequence, it's not the fact that an employee is tested positive, it's how we respond to that employee being tested positive and how we protect those co-workers, how we protect the entire business and the community those businesses are operating in. And the reason we came here is demonstrably this is a group that gets it and has been able to work collaboratively to get things done and partner again with local and state officials to allow these essential workers to continue to move forward and continue to generate opportunities not only for family members and those that are supporting their families, workers here, but as an economic engine again for Stockton and the broader county and state. So that's the reason we're here this afternoon, but we're also here intentionally for another purpose, and that's to build on what we announced on Friday. We talked a lot about the importance of protecting essential workers here in the state of California, protecting essential workers from the ravages of this virus and to maintain that structural integrity of an economy that disproportionately relies on those essential workers. I made this point on Friday. I'll make it again today. While we see positivity rate in the state of California growing modestly, we're seeing total number of cases certainly growing, a number of people losing their lives, and I'll talk about that in a moment, also growing. It's not happening evenly in every part of the state. There are certain parts of the state, certain regions in the state, and certain sectors of our economy that are disproportionately impacted by the transmission of this virus. We're here talking today about the Central Valley, 8 counties that have R-effective rates. Dr. Galley will remind you what R-effective is in a moment when he speaks. R-effective rates north of 1%. We have 8 counties where we're seeing an increase of infections. We have positivity rates in the Central Valley on the low end of 10.7%, in Fresno, Tulare, and Stanislaus on the higher end, 17.7% positivity rates. So you get a sense of the challenge we have in the 8 counties making up the Central Valley, disproportionately being impacted currently by community spread, and by spread happening disproportionately with essential workers, disproportionately in the Latino community, disproportionately impacting congregate settings, continuing to be vigilant around skilled nursing facilities, correctional facilities, and the like. That's the area of more of our laser-like focus in terms of our targeted interventions, in terms of our resource allocation, and in terms of our transparency and ultimately accountability to partner with organizations, both not only at the state level, local level, but also at the federal level to provide relief and diminish the spread and transmission of this virus. So today we're announcing $52 million investment, new dollars that will be put into the Central Valley, into the 8 counties to improve our isolation protocols, our quarantine protocols, our testing protocols, and to enhance our healthcare workers by providing more support as well as more personnel. $52 million that has been provided to us through a grant we received from the federal government, $499 million CDC grant, of which the first dollars we're now distributing, 52 again in 8 Central Valley counties, focusing and targeting on improving testing, not only providing more supplies and supports, but time to testing results. And you'll hear a moment more from one of our co-chairs of our testing task force to talk more specifically about some of our renewed efforts in this space. But these dollars we think are timely. These dollars certainly are critical and important, and they will build off local infrastructure that's already in place. What's also in place, deeply ingrained in our mindset, is the example of what occurred in Imperial County and the work we've been doing in Imperial County now for a number of months to address some of the community spread that really flared up there disproportionately in that county. We were able to make some improvements in terms of the transmission and spread of the virus by deploying a number of strike teams. Some of you may recall these regional unified response teams that we deployed into Imperial County. We're announcing today we're doing exactly the same thing throughout the Central Valley. 3 teams representing 3 different regions in the Central Valley will be deployed along the same lines we deployed those teams in Imperial County. I'll remind you, those teams included members of the Office of Emergency Services, certainly members of OSHA, team members, Department of Social Services, as well as partners that we developed at the local level, including community-based organizations that will be helping us and supporting our efforts to truly unify our engagement, truly unify our approach and framework to mitigate the spread of this disease. We've also created at the State Operations Center what we refer to as the SOC, a new Central Valley task force exclusively focused on the needs of the task force, or rather needs of the Valley. That task force focusing on this unified, coordinated response and focusing on accountability and transparency at all levels of government. And so with the new supports, $52 million of new resources we're deploying, with these strike teams, which will be deployed in every one of the 8 Central Valley counties, with the renewed vigor of what we announced on Friday related to supporting our essential workforce, disproportionately engaging our employers, not in a punitive mindset, but a supportive mindset. The work we're doing in terms of increasing the acuity of focus related to identifying and isolating and quarantine individuals that may have either tested positive for COVID-19 or have been in an environment where someone was a close contact had been tested positive for COVID-19. That through the additional efforts with our partnerships that we are establishing, we announced Friday, including Project Room Key, which is being enhanced to provide isolation space and additional supports in terms of housing vouchers, primarily hotel vouchers that we're supplementing, and increased education, more targeted engagement to not only employers but to employees. So they know their rights in relationship to sick leave and in relationship to workers' comp. We think we are in a better position this week in terms of these efforts. And so that's the purpose of today's announcement. And Dr. Galley will come up in a moment and fill in a little bit on the details and some more specificity related to these efforts as well. Let me, though, first briefly update you on what occurred over the weekend, update you on the numbers since we last had the opportunity to engage on Friday. The positivity rates in the state of California over a 14-day period are at 7.5%. Left you on Friday, we were at 7.5%. They're holding relatively strong, up 5% over a 14-day cohort. So we've been ranging from 7.4 to 7.5 over a 14-day period. I, again, remind you that's in the aggregate. And the data that I just presented you related to the Central Valley shows a different picture here in the Valley compared to the state of California. Remember, 10.7% in Fresno, 17.7% Tulare, and Stanislaus, 7.5, however, statewide. The 7-day average, which has gotten more attention, is 7.8%, but 7.5 over a 14-day period. Hospitalization numbers, as well as ICU admissions, are increasing, but at a more modest pace than we saw 2 and 3 weeks ago. You may recall hospitalization rates in the state of California when we announced a 50% growth over a 14-day period raised obvious alarm bells. Over a 14-day period, we have seen that hospitalization rate now, in the announcement, today's numbers, increase 3%. So from 50 to 3%. I left you on Friday, that 14-day hospitalization rate was at 9%. As it relates to ICUs, you may recall hospitalizations were up 50% a few weeks back over a 2-week period. ICUs were up 39% a few weeks back over a 14-day period. The numbers we have out today are 14-day numbers related to ICUs have increased 7%. So from 39 to 7 on ICUs, from 50 down to 3% on the hospitalization. So again, we're seeing a growth rate, but we're seeing a modification, a decline in the rate of growth. It is not where we need to be, but it's progress indeed, but more progress needs to be made. And again, our efforts, our focus are really to target those efforts in areas that are hotspots, Central Valley and Southern California, particularly Los Angeles region, as, again, focus of a disproportionate amount of our efforts. By the way, on Friday, for what it's worth, the 14-day on ICUs was at 11%, again, down to 7% today on Monday. Related to the total number of positive cases here in the state of California, we have averaged, and I again caution looking at daily stats, both in terms of deaths and daily stats in terms of positives, because it doesn't always give you a real picture. We can run with headlines based upon data that appears relatively low, some that appears relatively high, and that's why we prefer the 7-day number. Our 7-day total number of positive cases is averaging 9,859 cases, 9,859 cases over a 7-day period. Number of deaths over a 7-day period has increased from 91, the previous 7-day cohort. The last 7 days, our average number of deaths, tragically, is 109. So the total number of deaths is certainly beginning to increase. Don't be misled. The numbers that we're announcing today are just 29 deaths. And I don't say just, because I am not naive about every one of those deaths being a loved one's lives lost and a family completely torn apart. And so our hearts go out to every one of those families. But 29 is today's reported number, but the 7-day average masks 109 average deaths per day. And I remind you, what more evidence do you need than that of how deadly this disease continues to be, how deadly this disease continues to be. For them that, some that say otherwise, these points of data and all of the pain and suffering these family members are going through is testament to a different reality. And please, let's wake up to that reality. Tests continue to rise in this state. Total number of people tested positive continues to rise in this state, and number of lives lost continues now to rise again, a trend line we've seen over the last few weeks, 109 average lives lost on a daily basis because of COVID-19. We tested 128,000 people yesterday, and we saw our total number of tests, those tested positive, just shy of 7,000. I think it was 6,891 to be exact, tested positive yesterday. Again, a positivity rate over a 14-day period at 7.5%. I know these numbers, forgive me, can be confusing, particularly when we don't have the benefit of all of that data on our slide deck. I encourage you, as always, to go to the COVID-19.ca.gov website, COVID-19.ca.gov website, and take a look at that data, not just data statewide, but data where you live, so you can understand the background rates, you can understand the community spread in your county, in your city proper as well. I want to, though, before I turn it over to Dr. Galley, just say a few things about this city, Stockton, and how proud I am of their mayor, Mayor Tubbs, who's really been leading the charge in this county. We're in a county that is struggling with an increase in the rate of infections and transmissions. A county, Stockton's in a county that is being challenged currently by staffing pressure in its hospital system, increase in the total number of cases in its ICUs, and that's why, because of Mayor Tubbs' leadership, because of his forthrightness, his willingness to really lead in many respects in this region, this is a part of the state where we have been able to get the support of the federal government and bring in these Department of Defense ICU healthcare teams. We now have 5 of the 8 teams. Those are the 190 personnel we got from the federal government that have come into the Central Valley, and notably, one of those teams is right here. And I want to just thank Mayor Tubbs for his leadership and for his demonstrable commitment that constantly is reminding all of us that good enough never is. And so we remain vigilant. We're trying to help decompress some of the stress within the hospital system with additional personnel. We recognize more personnel needs to be forthcoming. That's why it's important to note that $52 million commitment that we're announcing here today. But in addition to that, we continue to work to try to collaborate within the healthcare ecosystem. And remember, when one hospital is coming near capacity, that hospital system, that hospital is part of a system that has a coordinated capacity for mutual aid, not only within the county, but also outside the county. And so we're dealing with staffing flexibility. We're allowing for more of that. I think 64% of the 45 hospitals in the Central Valley have requested some flexibility on staffing. We're doing that to address some of the staffing anxiety, but we're also supplementing through some of the DOD personnel as well as Health Corps personnel, in addition to these strike teams that we've assembled that have many, many agency stripes, many that I referenced just a few moments ago. So, essential workers, a focus that really needs to be made on the Latino community, continue to do more and better to raise awareness and to educate young people. That cohort, 18 to 49, continues to see a disproportionate rate of growth in terms of infections and transmissions. And a reminder, before Dr. Galley comes up, as always, of the power and potency of this non-pharmaceutical intervention, wearing a face covering and a mask. We've been doing a lot of research, a lot of surveys, and in many respects, could just be anecdotal. While people have done, I think, a very good job, not universally, but disproportionately a very good job in their workplace environment wearing the masks, what tends to happen is we are also letting down our guard, not just at our workplace during breaks, during lunch, perhaps before and after work, but we're also seeing people that may be very, very vigilant in terms of face coverings at work, not be as vigilant when they're home with friends and family. And so another critical component of mitigating the spread of this virus is also reminding people, and we're educating, that was part of the announcement, and the new resources we're putting directly into this effort that we announced on Friday, but reminding people that friends and extended family, when you've been with people outside of your household and you're mixing, you're putting their lives at risk and your own life at risk if you're not wearing face coverings. And so, having just come through the weekend, that may have been you this weekend, where you're doing a great job today at work, but you may not have been as aggressive when Aunt Cindy came over and you hadn't seen her in 6 or so months, and she came right over, as she always does, and gave you a big hug and kiss without a mask on. And I know how difficult that is for all of us, and we're not going to blame anybody for that, particularly Aunt Cindy, for her expression of love and passion. It's just a reminder of the fact that we are in the midst of the first wave of this pandemic. And we have got to do what we did in the beginning, in the outset of this pandemic, and that is mitigate the spread, and we will. And we will do that much sooner if all of us maintain that vigilance and don't let our guard down, human though all of us are. And so again, I say this with absolute admiration and respect for everything we're all going through, many of you are going through at this moment. And so that moment has come. We'll now ask Dr. Galley to come up, say a few words, and then he'll introduce you to someone he introduced you to a few weeks ago, our new co-chair. We're just blessed, epidemiologist who we're blessed to have on our team back from retirement, working to address the issue of shortages of supplies and more laser-like focus on testing. Dr. Galley?
Thank you, Governor, and it's great to be here today in Stockton. I just want to echo the thanks to Mayor Tubbs, to the County Administrator, Monica Nino, and to Dr. Maggie Park, who has been a great colleague over the last many weeks. She's the local health officer here in San Joaquin County, who I know many of you are familiar with here locally, and just really working hand in hand across a number of tremendous public health leaders in the state who are trying to keep the drumbeat going on how we keep transmission low in our communities. We're here today in the Central Valley for reasons the governor already laid out. We are seeing top-level, high-level transmission rates, test positivity rates as high as 18% in some of the counties. We're seeing an inordinate number of cases across many of the 8 counties in the Central Valley that reach between 250 persons infected per 100,000 over 14 days, all the way north of 450. We've seen our effectives. Remember, that's the number of individuals who will become infected by any one person who's infected now. So it's really a measure of transmission rates. We see those increasing, and above 1, some as high as 1.4, which tells us we have a great deal of work to do to get transmission rates down here in the Central Valley. As the governor mentioned, the hospital beds as well as the ICUs in the 45 hospitals in the 8 counties here in the Central Valley are feeling the pressure. Some of the regular hospital beds that we depend on for everyday care are filled up with COVID patients to the rate of 65%. Same thing in the ICU beds. Some of the smaller hospitals, their ICUs, small and mighty and important to the community. Some of those, 65% of the patients today in those beds are COVID positive. So what that tells us is the moment is now to continue to work between the state and our local partners to get a handle on what's happening in the Central Valley. The unified response teams that the governor mentioned, led by Cal OES out of the State Operations Center, multidisciplinary teams across many state agencies that are putting sort of our feet where our mouth has been, right? Coming into communities, partnering with individuals like Dr. Park in her county and city colleagues to make sure that we're addressing everything, not just hospital surge capacity and whether we have enough staff and ventilators, but also way upstream, getting into places like Diamond, where we are today, where we know essential workers are part of the story of transmission, that we need to do more working with our labor partners here in the Central Valley, working with community leaders, all the way faith-based leaders, community groups, a number of the city and other local leaders as well, to make sure that our message around wear your mask, stay physically distanced, and reduce the level of mixing that we're seeing in our communities so we can get transmission rates down and really keep our communities protected over the long run. These unified response teams will have members of a number of different agencies, including our labor agency, our ag agency, our business agency, my agency, the Health and Human Services, with Department of Public Health, Social Services, Aging, a broad range of individuals who will come boots on the ground to work closely on every issue, from hospitals to skilled nursing facilities, to how we improve our messaging and communication, to increasing testing, to making sure that we have the staff necessary to do that contact tracing and disease investigation, and finally, and very importantly, building our efforts to make sure individuals who are positive can successfully isolate and quarantine in a safe and supported way so that we can reduce the lanes of transmission in our communities. Today's hospital numbers really came from infections weeks ago. So if we want the situation in the hospitals here in the Central Valley and throughout the state to improve, especially as we're knocking on the door of flu season and the normal amount of surge in those hospitals in the next few months, we need to do today redouble down our efforts to improve our own behaviors, the behaviors in our community, so we can get transmission down, so these numbers in the hospital are reduced in the next few weeks. With that, I wanted to take a moment and invite back Dr. Hugo Chavez, who just retired from state service at the end of last year. He immediately reached out, as we were reaching out to him, offering up help. He's been with us since the beginning of our response to COVID. I recently asked him, and he agreed, to be one of the new 2 co-chairs of our revitalized testing task force, focused not just on ensuring that we have capacity with testing in our state, but also that we're looking at equity and making sure we're targeting communities like the Latino community, other communities of color in parts of the state like the Central Valley, where we know there's a disproportionate impact. That even though Latinos make up a certain portion of the population in each of the Central Valley counties, they make up a greater proportion, sometimes 20, 30% greater proportion, not just in the number of cases, not just in the number of patients in the hospital, but also in the number of deaths. So making sure that we're communicating clearly and concisely around messages that can reduce transmission, as well as ensuring that testing is in high quality and high amount within the Central Valley. So it's with great pleasure that I invite Dr. Hugo Chavez to the podium to share a few words, not just about testing and the testing task force effort, but just what we need to be doing as a community at large to reduce transmission as we continue our battle against COVID across California. Dr. Chavez?
Thank you, Dr. Galley. Thank you, Governor Newsom. I actually am going to switch gears and make my presentation in Spanish, if you don't mind. I am here today con una preocupación profunda sobre nuestra comunidad latina con respecto a la infección del coronavirus. Vengo aquí como representante, como miembro de nuestra comunidad, como padre, como hijo, como abuelo, para hablar un poquito sobre lo que podemos hacer los latinos para protegernos más unos a otros. Primero quiero agradecerle a la administración del gobernador por su interés tan profundo en nuestra comunidad y por la inversión que están haciendo de 52 millones de dólares en la zona en la que estamos ahora mismo del centro de California para tratar de combatir este problema más efectivamente. también con un poquito más de recursos del gobierno para que ayuden a las autoridades locales. También quiero reflejar un poquito, y mucha gente me pregunta, ¿cuáles son las estadísticas de los latinos con relación al COVID, al coronavirus? Y es una situación tan profundamente preocupante que la quiero discutir un poquito. Cuando vemos las estadísticas a nivel estatal, vemos que los latinos comprenden casi el 45% de todas las muertes por coronavirus en el estado. Más importantemente, en algunos grupos por edad, la gente más joven, hay grupos que tienen casi el 70% de la muerte son en esos grupos de edad. También hay un mito de que dicen que la gente joven tiene infecciones del coronavirus muy leves y que no es gran problema. Les aseguro que en nuestra comunidad latina, las infecciones en la gente joven no son siempre triviales. Tenemos muchas infecciones en gente joven en edad reproductiva que resultan en la muerte. Entonces, este es un problema muy importante y muy profundo para nuestra comunidad. También quiero revisar un poquito, la gente me pregunta, doctor Chávez, ¿por qué es que los latinos estamos más afectados? Y en base a la investigación científica, al conocimiento que tenemos de los casos, hay 3 ideas fundamentales de por qué esto está sucediendo. Primero, tenemos en la comunidad latina una gran proporción de enfermedades crónicas, sobre todo en la gente de edad avanzada, diabetes, hipertensión, obesidad y otras enfermedades que nos ponen a más alto riesgo de la infección y más alto riesgo de que nos enfermemos severamente si nos da la infección. Segundo, vivimos en situaciones familiares y personales que muchas veces aumentan el riesgo. Yo tengo familia, tengo amigos en que en una casa vive la abuela, vive el papá, vive la mamá, viven los hijos, viven los sobrinos. Entonces son casas multigeneracionales donde hay gente de diferentes niveles de riesgo. También tenemos situaciones en que estamos viviendo con otras personas por situaciones económicas. Hay casas en que hay 3, 4, 5, 6 gentes compartiendo una habitación. Todo eso nos pone a más alto riesgo. Y por último, tenemos la situación ocupacional. Los latinos estamos sobre representados en los servicios esenciales que tienen que asistir para que la comunidad siga funcionando. Somos las personas que trabajamos en la agricultura, somos las personas que trabajamos en situaciones de apoyo a nivel de hospitales, a nivel de toda la comunidad. Somos la gente que prepara alimentos, somos la gente que conduce autobuses, entonces somos gente de muy alto riesgo en cuanto a exposiciones, porque no podemos estar en casa siempre encerrados, tenemos que salir a la calle. Entonces, por todo eso, los latinos tenemos un alto riesgo del coronavirus. Pero hay cosas que podemos hacer como comunidad para protegernos, muy, muy importante. Primero, hay que asegurarnos que vamos a practicar el distanciamiento físico y a usar el cubrebocas. Este cubrebocas que me ven, yo no me lo he quitado porque se ha convertido en mi mejor amigo. Yo no salgo de mi casa sin mi cubre cara, porque esto yo sé que me protege a mí y protege a otros miembros de la comunidad. Entonces yo quiero realmente recomendarle a la gente que siempre que salgan de su casa, siempre que no puedan practicar distancia física, se pongan un cubrecara. Muy, muy importante. Segundo, el distanciamiento físico tan importante. Yo sé que es un poquito difícil siempre pensar en esto y practicarlo, pero a largo plazo reditúa mucho. Mi madre vive muy lejos de mí, ha estado enferma, y yo no he podido ir a verla porque yo sé que es una persona mayor que si yo la voy a visitar viajando mucho, es posible que le introduzca un riesgo. Entonces, tanto extraño yo a mi madre, pero no voy a verla porque sé que la protejo por no ir a verla cuando no debo estar allá ahora con ella. Entonces, todo eso es importante que lo recordemos para protegernos no solamente uno a uno, pero a toda la comunidad. En segundo, asegurarnos que cuando vamos a trabajar, practicar todos los lineamientos de protección para estar asegurados de que no vamos a infectarnos e infectar a otros. Y cuando regresamos a casa, asegurarnos que nos vamos a usar buena higiene para limpiarnos las manos, para quitarnos todos los virus que podamos tener. Situaciones muy, muy importantes. Entonces yo quiero realmente hacer un llamado a la comunidad latina para que abordemos este tema realmente como comunidad. No es de protegernos uno a uno, sino protegernos unos a otros. Proteger la casa, proteger la familia, proteger a los amigos y proteger a la comunidad. Muchas gracias.
Thank you, Doctor. And again, thank you for all your leadership and support on this testing task force. And I'll remind you, a few weeks ago, Dr. Chavez was announced as one of our two co-chairs of a new testing task force effort. You may recall 100 or so days ago, a little over 120 or so days ago, we were averaging about 2,000 tests a day. I noted yesterday we conducted over 128,000 tests. We recognize that we still have a lot of work to do and that not every part of the state is experiencing the same testing capacity as every other part of the state. We are hearing about challenges with supplies, again, viral media, transport media, issues related to reagents, other related issues that continue to be vexing. But more importantly than anything else, it's incumbent upon us to really focus in on our testing in these areas that we have identified as the most vulnerable populations and most vulnerable sectors as well as regions in this state. So again, I wanted to thank Dr. Chavez. Also want to thank two people that could not be here that have been instrumental in bringing us here, and that's Assemblywoman Eggman and Senator Galgiani. The legislature has to confer and meet as it relates to the distribution of these $52 million of new funds into the Central Valley. I want to thank them for their leadership and their support of that effort. I want to thank many of the other elected officials, representatives in the Assembly and Senate as well, for their counsel and advice as it relates to distribution of funds. Not just distribution of funds. I noted just a moment ago when complimenting Mayor Tubbs. Fact is, we have those resources coming from the federal government, and those resources and the decision-making is guided by local decision makers, and they are instrumental in those efforts as well. Look, we have an enormous amount of work still to do, not only here in the Central Valley, not just other parts of this state, but all across the state of California to ultimately vanquish this disease. We now have 37 counties. We just included Santa Cruz on the monitoring list, 37 of our 58 counties now on the watch list, as referred to, the monitoring lists. Those are the lists, or those are rather cohort of counties that are on that list that are getting most support in terms of targeted intervention and efforts to mitigate the spread of this disease. Let me thank Dr. Galley as well and Mark Gilladucci for their efforts in terms of the creation of this task force in the Central Valley and the framework to get ahead in terms of mitigating the spread of this virus in the Valley, learning the lessons from Imperial County and some of the examples, partnerships that really proved to be incredibly well, successful. And that is said very soberly, because we recognize while we've seen some progress, significant progress in Imperial County, we still have a lot of work to do in that county as well. So that's the update for the day. And now, of course, as always, I look forward to answering any questions, and Dr. Galley and Dr. Chavez are ready to answer them as well.
Good afternoon, Governor. Nicole Nixon with CAP Radio News, and I'll be asking questions on behalf of the press today. Speaking of the state watch list, Angela Hart with Kaiser Health News asks, most counties are on the state's watch list, so do you have any plans to reconsider your approach, allowing counties to open at their own pace based on local conditions? At what point does there need to be consistent and uniform statewide standards for public health order mandates?
Well, there are statewide uniform standards, and we certainly have organized 93% of the population represented in those 37 counties. But there are counties that are not represented on that watch list. There are unique conditions that exist and persist within that cohort of 37. Let's just, for example, pick the 8 counties here that make up the Central Valley. Even within the Central Valley, you have positivity rates, 10.7% in Fresno, and Dr. Galley just referenced as high as 18%, 17.7% in 2 counties. Different conditions, different challenges, even within a broad geographic region that often is identified in the same breath as one region. So my point is, one has to get under the hood, one has to distinguish, and as a consequence of the protocols we put into place as relates to our monitoring lists and the criteria we use to monitor, that's a dashboard as it relates to positivity rates, relates to ICUs, hospital capacity, relates to testing protocols, isolation, quarantine protocols. Each county has their different capacity, different needs, and different expertise. All of those will be assessed on an individual basis as relates to the further modifications of the same.
The legislature reconvenes today. They have a lot on their plates with pandemic response and other issues. Have you spoken to legislative leaders about a possible special session, and would you call one if there is not enough time for them to get through everything?
Yeah, as needed, we'll consider it, but as needed. And right now, I have not called for one. It's just suggestive of our current position, but again, it's a dynamic process, and we'll be adaptable and we'll be flexible, and we could not be more proud of the partnerships and the leadership of both the Assembly and the Senate.
Legislative Democrats unveiled a $100 billion stimulus package today. Have you spoken with any lawmakers about this plan? And if so, just want to get your reaction to it.
I haven't had a chance to review. There were a number of modifications that were made recently. I haven't had a chance to review it in any detail. I'd be remiss to comment until I have a chance to review the details, and happily will make our position well known, and appreciate again the leadership, Senator Hertzberg in particular, going back now many, many months, and his commitment to economic growth, economic development, but also to a paradigm of focus on inclusion, growth and inclusion. And that's foundational in terms of any package that needs to move forward. We have to include a framework of bringing people along as we reopen our economy and as we grow our economy.
A couple questions for you, maybe Dr. Galley or Dr. Chavez. I want to go back to the updated testing standards. One, have those new guidelines made meaningful changes in who is getting tested, or allowed us to better understand and contain outbreaks, and if not, why not? And also, can you clarify how the new guidelines apply to individual people who want to get tested? Is the state still advising anyone who wants a test to get one? Are you still encouraging everyone to go to the state-run testing sites?
No, it's an opportunity, again, to have a chance to remind people of what the new protocols and procedures and priorities are. And now we have our co-chair and the head of HHS will do just that.
Thank you. That's an excellent question, and I want to review the fact that we issued those prioritization guidelines because we found at a time where there was testing constraints across the nation, and we felt that it was best to manage the testing capacity we have in California to achieve two goals. One, to support the clinical care of people and patients in hospitals, and secondly, to ensure that we continue to do our public health function of contact tracing, outbreak detection and control, and ensuring that people that need to provide vital services have access to testing. So that's why we issued those updated guidelines. And so that leads me to your second question, which is, are we at a point right now where we can say everybody that wants a test needs to get a test? The answer is not today. We need to prioritize the testing for those who need it the most and for public health purposes. As we continue to increase capacity, and we are doing that, as you see the numbers every week, they continue to increase. We have plans to increase them even more. Then we'll open up the testing to anybody who wants to get a test. But now we need to really use that for public health purposes.
Just to pick up on one other part of your question, which have we started to see a difference now that we have the new testing guidelines there? We have seen for certain facilities where the test turnaround time was really increased, that the prioritization of certain patients and people with symptoms are now getting their test results a little bit faster. We hope to see that improve over time so that we can deliver on exactly what Dr. Chavez said and use the power of testing to give early and quick diagnosis so that we can not only take care of patients in hospitals and other settings better with thoughtful treatments as it relates to COVID, but that we can give that information to people who wondered if they'd been exposed, are positive, so that they can effectively quarantine and isolate from others so that we can reduce transmission across the state.
As I previewed on Friday, tomorrow we'll be announcing some new innovation, or these strategies for innovation in the testing space. Look to that. And also, we reminded folks of our commitment last week to partner with institutions, both public and private, and UCLA, Stanford, among them, on pooled testing, now that we have finally seen some flexibility in the rulemaking coming from the federal government. And pooled testing will substantially aid some of our efforts on the asymptomatic cohort in particular, and help us potentially in large settings like schools and others to increase our capacity with limited supplies.
Governor, I got some questions about demonstrations that happened in front of your home this morning, including some people that chained themselves to the gate. They are calling for more inmate releases and other efforts to mitigate the coronavirus spreading in state prisons. First, just want to get your reaction to these demonstrations at your home. And second, does more need to be done to keep the virus from spreading and inmates dying in custody?
We've been making a lot of progress in this space. As many of you know, a number of months ago, we announced a cohort of 3,500 prisoners that were nearing their release date, and we moved to expedite that release in a methodical way in partnership with counties, our probation, parole, personnel, and the like. I recently announced an additional cohort of 8,000 individuals. Today, we have just shy of 111,000 individuals in the CDCR system, our California State Corrections System. That's about 12,000 less than it was just a few months ago. So we're moving in a methodical way, but a judicious way, and we have a criteria that's bracketed in terms of those that would be eligible for early release, and we have a responsibility to those individuals as well as the community, victims, families, and the like, to do so in a thoughtful way. The worst thing we can do is mass release, where people are just released out to the streets and sidewalks and end up in benches, end up in parks on the side of the road. And that's not compassion. That would be compounding a problem, making a problem, in fact, worse. So we are working diligently, aggressively, and very methodically, but in a targeted way. And we're working in partnership with not only the federal receiver, but federal representatives, including a federal judge who has really been proactive and has been an incredible example in terms of his fortitude and his desire to keep people safe within our system, at the same time to keep everybody else safe outside of the system.
And then finally, I wanted to ask about sports. With the coronavirus outbreak on the Miami Marlins already putting the new and the Major League Baseball season at risk, do you think it's safe to allow pro sports teams to play here in California, even without fans in the stands?
Well, there's protocols and procedures. I've had a lot of conversations with Major League Baseball, both with some of our local, meaning statewide representatives, owners, and the like, but also with Commissioner of Major League Baseball. I haven't been shy about this. Go back to comments I made many, many months ago, and sort of anticipatory comments of concerns, not just with baseball, basketball, particularly contact sports like football, and my concern about outbreaks and having to cohort, isolate, quarantine individuals, and what that would do to not only Major League sports, but also sports as it relates to sports that so many of us as parents love and are thrilled by, and that's ones that our children participate in our K through 12 education system, and of course our system of higher education. As you saw, our K through 12 education system put out new guidelines as it relates to sports and pulling the leagues or pushing the leagues back into the fall and into the new year. We'll be putting out subsequent guidelines on team sports even outside of our K through 14 and higher education system. But we continue to work collaboratively, county by county, with our health officers and with players' representatives. I was just on the phone few days ago with National Football League player representatives, the Players Association, working through protocols, offering expertise and advice and exchanging information. So this is a dynamic space, and what happened with the Marlins, just a reminder of how virulent this disease is and how easily transmitted it is as well. With that, let me thank all of you for the privilege of your time, and we thank Diamond in particular for the privilege of this location. Thank you as well to Diamond for being a big part, I'll end as I began, that they've been a big part of the economy here in the Valley, big part of the community here in Stockton. And I want to just thank them, their entire team, for their graciousness, support this location, and their cooperative spirit, an example of what business can do and should do in partnership with local health officials, county as well as state officials in operating in this environment. I again want to thank Mayor Tubbs and his team, as always, for their leadership and for their stewardship, as well as their accommodation here today. And all of you, thank you for your vigilance through these difficult times. I'll just end by stating the obvious. This disease continues to grow in the state of California. It continues to spread, but not evenly. It is disproportionately impacting certain communities and certain parts of the state, but it also is impacting all of our state and its economy. And so let me just express deep empathy and deep respect to each and every one of you for your patience and, more importantly, your perseverance, for your adaptability, for your flexibility, and your commitment to the collective cause that is this great state. We will get through this. This is not permanent state. This is not the rest of our lives. Quite the contrary. We have remarkable capacity to bend this curve again. We did it as a state many months ago. We will do it again, and there are areas where we are seeing progress, and I noted those as it relates to the rate of growth beginning to diminish on hospitalizations and ICUs. But that, again, does not tell the entire picture, because in certain parts of the state, including where I am, we are seeing an increase, and that impact is profound, and it's precisely why we made the announcement we have here today. And so let me thank all of you for your continuation of the theme to wear face coverings, to practice the social distancing, the physical distancing. And please, in closing, again, I can't mandate anything. I can only help influence. Just to consider not only yourself but your loved ones when you are with friends, when you are with extended families outside of your household. All that good work that you're doing at work and when you're outdoors and you're going grocery shopping, bring that home as well, particularly when you're bringing other people to your homes so that we can more quickly mitigate the spread and transmission of this disease. We'll get there together, and we'll get out on the other side more capable than you could ever imagine as a state, and I believe this as a nation. So let us continue that cause collectively, and let me thank you from the bottom of my heart for everything you've done to date and your perseverance and your persistence to get us through this. Take care, everybody.